And officially call this meeting to order. We're now at a point of informal key candidate introductions. I'll turn it over to Town Manager Osberg right now to give us more information and instructions. So,
Thank you, Mayor. So we've set up for item number one, which is informal Apex Police Chief candidate introduction. So we've got Trevor, who you are familiar with, our current Deputy Chief, current interim chief. So this is the time that the meeting will begin at 3:30 with the pledge, but for now, the meeting is officially open. But this time is mingle and just interact with the candidate. And then after 5 o'clock, which is when the meeting or the work session will be done, we'll have two more introductions and kind of mingling after 5.
sounds good.
Right.
So we'll go back and do what we were doing before.
Yes, all right.
Okay.
Well,
You were saying that. I know. Yeah. Yeah. Okay.
I'm not really sure. I think that's kind of what it is.
Thank you, everyone. We'll go ahead and make this an official call to order for the meeting. With that, if you would please join me and stand for the pledge of allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. All right, looking at the agenda, I know we have a lot to go over, and then we also have a timeline we need to finish by. So I'll turn it over to Town Manager Randy Bosberg to lead us.
All right, thank you, Mayor. And as you did point out, we have a tight timeline and a lot of things to talk about. So we will jump right in. I think, Trevor, you're going to start this one for us.
Absolutely.
All right.
I will just do introductions because the two best people, most eloquent speakers will be Megan, who is with the police department, and Tom Platt. Megan Simpson is in our Office of Professional Standards, and she is heavily involved in our CART program. And then Tom Platt from Wake Med, the two of them will share really the crux of what we're proposing.
Yes, and also I'd like to recognize Dee DeWitt, who's one of my colleagues from Open Minds, who's also here. So you see me pull him in, you know, that's what he's just here to help. Also, I would like to offer, you're welcome to ask questions as we go through this presentation, so you don't need to wait till the end. But I will tell you, I will start over once the first question. So really what we're talking about is a very unique, one of a kind, clinically integrated opportunity here between what we're doing at Wake Med, which is with our behavioral health, the Wake Med Behavioral Health Network, and the CART program. And so we're really excited, been working with Megan and Kia on this opportunity for quite some time. And so we're really excited about what we can share with you guys today. And so obviously this quote probably resonates with everybody in this room. Typically what we see in an emergent situation, you all coming forward.
Yeah, I would say in every community, and that includes Apex, and most of the people in this room know this, the first responders to behavioral health incidents are law enforcement. The police department is the location that is called when somebody is in crisis, because law enforcement is presumed to have the tools necessary to address that situation. We talked to Chief Herman, fire, they don't have those tools, but we do. At least we're presumed to. I would say we've taken a step in the right direction in adding our crisis response teams. But the fact of the matter is we see a lot of the same people, just like emergency departments, over and over again in that cycle of treatment, some level of recovery, and then reemergence of symptomology. So we really are truly the first responders when it comes to behavioral health.
And so we're excited in developing this partnership with Apex and your strategic plan. I think this marries really well together. And one of the things many people, oftentimes when I'm doing this presentation, people ask me, what Wake Med make the decision to build the Health Network? And, this isn't a surprise to anybody, but it's really, when I do this presentation, sometimes I used to show a slide where there was Wake Med Health and Hospital Systems with the tsunami, with the behavioral health and mental health needs of the community coming over the top of the hospital. And so what we realized is without collaboration, without community involvement, without bringing all those parts and pieces together, there isn't one solution that's going to work. So really managing through how do we communicate differently? How do we present not only clinical teams, but our crisis management teams? How do we bring all that together and then be able to manage how we serve our individual communities?
One of the pillars that we've discussed as an extended leadership team here at the town is welcoming community. The police department operates, as you know, 24 hours a day, 7 days a week. We currently have one co-response team. That's one officer and one social worker who cannot work 24/7, nor do we want them to, because they would burn out. So we're looking at expanding the reach of what they can do as one team until, of course, you all graciously give us more bodies. But in the meantime, we have one team, and this platform will allow them to do better, more efficient work with the human capital that we have. Additionally, this is what I call a P3, a public-private partnership, which is not often talked about in the realm of public safety, much more in economic development's wheelhouse. However, it does leverage a relationship we already have between the police department and Wake Med, because obviously they're a provider for involuntary commitments, other type of behavioral health requirements. This will be in place for the good of the community, for the good of Apex in general. I like public-private partnerships because I think they combine the best of the accountability of government with the innovation that is allowable in the private sector. So that's great about this. Are you going to talk platform before I show my 2 cents?
No, you can't have to. We've got some other components in the slide, so you go right ahead.
Okay. What I really want to stress here is this is an innovative program, not just for Apex, not just for North Carolina, for the United States. There is no public-private partnership that partners healthcare with law enforcement in this way. So this is building out an entire platform for law enforcement that would be comparable to the providers that are on the platform with Wake Med as it stands right now, which makes it a separate platform for obvious reasons. We need to have a separate platform. But we would like to get the kinks worked out from this platform and then start moving to partnering with Wake County EMS, which would be a great partner, as well as other law enforcement agencies in Wake County and beyond, because it is such an innovative tool. But we really need to work on it here for Apex first, and really wanted to work on it for Apex first because we have specific needs for this community that are not mirrored for every other community. So for us to own the platform, work on the platform, and then be able to push it out from there is a win all the way around.
I'll provide a little bit more detail. So again, we do have what we call our Care Connect platform, and that component. The other component is that we have 45 agencies that we have partnered with and collaborated with. And, you know, many of us have been part of collaborations in communities that bring organizations together, but oftentimes we get into these meetings, we do some things together, and then everybody goes back and does their full-time job, and not a lot changes. Well, here we've created not only a relationship with our partners, but we have metrics that we hold each other accountable to. We have a process where we provide oversight together. So we really do have what we call an integrated care management team that's really working together to improve care. So what are some of the things that occur through our network? Number one is we get rapid access. So all of our network providers who support and be part of our network have promised to give us enhanced access to services in order to be part of the network. We have timely access to services. We also have timely response. And so we also have what we call a care match logic system. So when any of our clinicians over at Wake Med currently use the system for a referral, they complete a little bit of some clinical information, some demographic information, and then we have a matching logic in our system that then lets our clinicians know which agency best matches for that individual patient. And that's based on a number of different domains. It's where does the patient live? What kind of insurance do they have? What are their clinical needs? All of those things. So when you're out in the field and when you're trying to figure out where's the right situation for this patient, not only trying to figure out what the individual needs, but what's the right match, we take a lot of that guesswork out, and a lot of that research and Google searches and phone calls and those kinds of things. All that gets put away because our system is able to provide that matching system.
Can I ask, I feel like I don't have the background enough of what the status quo is right now when there is an issue at Apex. Like, if you're talking about some things that are happening here, but what happens right now without this system?
So for us, when a call comes in and it involves the crisis response team.
Yeah.
The social worker and the officer who are involved go out to the scene, first secured by the officers who are there to make sure that it's safe.
Yeah.
And then our crisis counselor really establishes a clinical relationship with that person, if that is possible at the time, to figure out what that I would say do an assessment of kind of just a baseline assessment of what's happening. Talk to the family if they're available to talk about what the crisis is, see if they can get some type of a grip on what the situation is that's occurring. If that person requires involuntary commitment, then they would work to get that person transported to be evaluated at the hospital. If it's something that they can stabilize on scene and then talk to the family about getting resources as a follow-up, then that's what would occur. But in just looking into this situation, what practically Kia does right now is, let's say it's stabilized, that person does not need an involuntary commitment, that person is not going to jail for any type of reason, they're going to remain in the home. Let's say it's a juvenile that's out of control. She would talk to the family about resources, and then she would spend literally hours on the phone calling locations or individual treatment centers to say, hey, we've got this person, could you take an appointment, whether that's an appointment in an office, whether that's a placement, whether that's an evaluation at some type of location. That's really all manual work that she does through her background and experience in social work. And it's really just where she already has relationships, or like Tom said, Googling, is it an eating disorder? Is it a out of control teen? Is it, she's going to call the places we work with regularly first, and then she's going to delve into other places if they can't get a bed or an appointment rapidly.
Okay, and so this manual process obviously sounds inefficient, but also there are often not available resources at those places.
Yes.
Is that pretty common,
Correct.
I guess? Okay.
Yes, and I've said it juvenile, but it works the same way with adult resources as well. Both of those are limited. And I mean, just quite frankly, when you're calling as a social worker from the police department, it's you have a limited amount of leveraging in that environment, right? I mean, that's you calling and saying, I've got somebody, we were called out there, we need some help. Can you see them tomorrow? Do you have an appointment, next week, which is sometimes too late. You really need to be able to leverage those resources immediately because that person is in crisis. And a week or two later, we were talking about earlier, you'll call the family and they'll say, oh, it's fine now. Everybody's fine. They've calmed down until the next
Till the next time. Okay.
Right.
Okay, thank you.
Does that give you some
Yeah.
clarity?
Can I ask some follow-up questions? So we're talking about people that are in distress themselves. What about victims of a crime? Or like, is that part of, like, do we consider that crisis response as well? Or is that a completely separate scope altogether?
We have a victim advocate that handles.
I know we do, and we have chaplains and people too, but that's like, is that part of kind of the coming together here too? Or is that still a separate stream?
Well, it could be. It's certainly our victim advocate to utilize these services as well. What we're trying to do with this platform is to have one point of contact that is a clinician who is able to access the platform and schedule appointments and do the assessments. So Danica, our victim advocate, could work with Kia if she had a situation, let's say a domestic abuse situation where the victim or children in the family need services. We're really trying to keep the point of access to a clinician so that a clinical relationship is built, so we can separate that from the public aspect of the work that the police department does and allow for some privacy for the individuals to access services. So,
Right, because I see a lot of overlap there.
Yes.
So I just want to not forget about the victim support in addition to, because there's a behavioral and then clinical behavioral crisis, that's in play there too.
Part of what you're asking is triaging through the victim advocate, because the state and the department has certain avenues and requirements for victims of certain crimes. So from a victim perspective, we're gonna look at the victim side, the criminal piece first, and then potentially circle back to determine if this would provide any additional resources and things of that nature to create an advantage that we don't have currently.
I have another point, and then, of course,
So
go
that-
ahead with yours.
So the other point I wanted to make was, not only will this opportunity and this platform help Kia and whatever other team members would like to use it to see where they can make the referral, get the connectivity, and see actually when when appointments are scheduled, all of that is live. But then they'll also be able to see what's the follow-up. Did the patient attend their appointment? Did they actually get seen? All of that stuff is in the platform, and we'll be creating also dashboards and data that will come out of this to lead the team to see where there's been success and where there's other new opportunities. And so it really does lend itself to allowing opportunities to build themselves in terms of not only, again, it's technology, but there's more to it than that. And it's this network behind the technology that really makes it work, because we've got 45 organizations that are part of that network and growing. We have over 2,500 clinicians. We have over 1,200 beds that are in that system. And so once that platform is open and accessed, all of those resources are now available. And the great thing is, and I'll show you some data in a minute, is how we get access and how we get leverage that access to support our patients and really meet their needs.
So yes, it is triage and crisis, and our crisis response team is named for crisis response, but they also do follow up and case management, and they also respond. They receive a spreadsheet normally when we have computer aided dispatch or CAD, which catalogs all of our information, which of course, as you all know, we've not had for a while. That information is available to both our victim advocate and to our crisis counselor on the next day. And they're able to go back through the list of incidents that happened, perhaps if they were not at work, and they can follow up with families and individuals to see if they need services. And we also do that. So it's not always just at the time of crisis. So it leaves more room and opportunity to discuss the needs of that family, to offer them the services. And really that's just to pull it off of the 911 or the non-emergency lines, so they're actually connected to the services they need. They don't need the police, they need an appointment with a psychiatrist, right? So we're trying to follow up on the back end to take that pressure off of the calls that police are not. I mean, let's face it, they're not equipped to come in and give them a referral to a psychiatrist. So there are a number of ways that the information comes in. So the platform is available to the police department as a whole, I think, in answer to your question. It's a holistic solution. There's just one manager of the information, which would be our.
And so today we have only one counselor, Keith.
Correct.
And this slide really is, and I think most of you in this room probably are already aware of this, it's just the cost of not getting care, right? If you're not accessing care, there's a cost associated with not only to family members, not only to that individual, but then overall cost of care. And that drives, or lack of resources, it drives the inability to expand services, those kinds of things, because there's such a high cost of not getting care that drives everything. I want to point you out, there's a lot of data on this slide, and if you guys want any other information, I'm glad to share. But what I want to share with you is a couple right there in the middle where it says 2 hours and 4 days. So as part of our network, what we hold accountable to our network members is if you receive a referral from Wake Med currently right now, and it's during business hours between 8 and 4:30, we expect those outpatient providers to respond within 2 hours whether you're accept or decline. Now, our declination rate is lower than 2%. Why? Because we have the matching logic. So oftentimes when the referrals go out, they're already a match to that particular provider. So there isn't a need to do a lot of research and going back and forth. It's just looking at what some of the clinical presentation is in the documentation, which we can share. And then it's a matter of acceptance. Typically, when we get a declination, it's because, and each of our members keeps a profile in the platform. So that keeps us updated as to the services they can provide. Has there been any changes? Did they contract? Did they lose a contract? Did they lose some therapists? And so did they shorten the program, or did they shut the program down? All of that information is captured in real time. So usually when we get a declination, it's because somebody didn't update their profile and we sent a referral that they can't match. And so then they send it back and then we send another one, but it's very low. The other part is, on average, we expect all of our members to give us an appointment within 7 days. Well, discharged from Wake Med, but in this case, it'd be for when the referral is made. The average right now, over 65% of the referrals that we send, and again, from Wake Med, it's over 450 referrals. Our average is 3.9 days. So when you start to think about access, when you start to think about getting care, and thinking about a critical incident in the community or a crisis moment, to get to that care very quickly, this is that kind of matching opportunity that we are able to provide within our network.
What's the geographic scope of this network?
It's around, well, pretty much across the state right now. So,
Okay.
So when I built the network initially 6 years ago and invited our network members, first of all, they all had to meet certain vetting properties and expectations and quality metrics, CARF accreditation, things like that. But also, because of Wake Med, if you did a heat map of where patients come from that we see, because we have the bus station that literally parks right outside the ED and the train station's not very far, we get patients who come in and then when they get treated, they want to go back to the communities in which they come. So we get patients who want to go back to Asheville or down to Wilmington when they get discharged. So when I built the network and I brought providers in, I was very intentional, not only that they had a significant presence in and around the Raleigh area, but also that they had offices spread across the state. And so I don't have the map attached to here, but I'd be glad to share. So we have programming that literally covers from Wilmington out to Asheville and everything in between.
But most people in Apex are going to want to stay in Wake County.
Yeah.
Too.
And so 90% of all of our members all have, I mean, it's like, yes. So we have 17 outpatient providers, for example, that all have a significant presence in the Raleigh-Wake County area.
And can I ask, so you mentioned like 45 partners, or one of the slides mentioned 45 partners. Can you give me an example of a partner? Is it kind of like a private practice, like
Oh,
mental
no, great
health
question.
providers?
So-
Or like, what kind of partners are we
There
talking
a
about?
lot, we have, for example, Monarch Southlight, just gonna run through these, Easter Seals. We have, MindPath, which is a private company. We have, Fellowship Health Resources. We have,
You don't have to list them. all.
yeah,
Just list them.
but it's just an example. I'm just trying to run through. I was trying to think of some that are community focused
Right.
and then those that also do more of the private work as well. We have a combination of both, because again, when you look at, we built the network to really start with to serve the needs of what comes through our ED. So a high percentage are Medicaid and Medicare, but then we also have a decent percentage of patients who have a commercial insurance. And so
So let me ask the question maybe a little bit differently. So these are providers that operate outside of the walls of the Wake Med facilities, right?
Oh, absolutely,
Okay,
yeah.
because you have your kind of independent providers within the Wake Med facility, your scheduling pool and everything else, right? And so
Yeah.
these are providers that operate kind of outside, they're kind of like the next ring around your ecosystem.
So just to make it clear, Wake Med does not own or operate or physically manage any of these. These are just, it's a collaborative relationship with the community. So Wake Med, up until we opened the Wake Brook in this past May and took over when UNC closed, we did not operate or serve any active treatment from Wake Med. So we don't have an outpatient provider. We don't have an outpatient program. We don't have any of those things. Wake Med does not provide behavioral health service. That is why when we were looking at the issues, when I initially came to Wake Med, we were seeing over 890 people a month who needed a behavioral health consult coming through the ED. And we realized that if we don't do something very soon, we're going to get overwhelmed. And then since COVID, it's now over 1,300 a month. So those partnerships is how we were able to make sure patients got through a continuum of care. So between outpatient, inpatient, and then we also have what we call a connected community, which focus on the social determinants of health. So housing, food, insecurity, those kinds of things. We have a partnership with them as well. So that builds out a network. Great questions. Real quick. So we built a lot of accountability. So you can have great community relationships, collaborative care. We can do a lot of things, but we don't have accountability. Things fall through the cracks and people don't get the resources. So we've built, we have accountability, we have dashboards, we have expectations. We also have a shared governance program. So I meet every month with our network. We talk about clinical issues. I have a network committee that we work on process improvements, and we put people on PIPs and organizations if they're not meeting certain standards within the organization. And I also have a board that I report to. So as the executive director of this, I have 4 Wake Med executives and 3 network members that make up our board. And so I go through the process of sharing data and information on a bi-monthly basis. And sometimes I ask a lot of hard questions as to where we need to go in our network. And so it is a very integrated system of care that we've created, and that has given us some of those outcomes that I showed you earlier on the data. Because I can guarantee you that you go anywhere else around the country, and if you try to get access to behavioral health care within 4 days, very unlikely you're gonna find it. And it's just kind of a physical list. Okay, good. So here is the proposal that we're making. So number one is we would bring the CART program into the Wakeman Behavioral Health Care Match platform. So we would have to build out the specific needs of the CART program within that. We would give license subscriptions and everything else that's needed. So maybe we'll start with Kia, but we certainly can give more licenses out as the program grows and we see effectiveness with it. And if there's ways to expand it, we will certainly be able to do that. All of that would have, we also have a direct messaging feature. So not only do we have the ability to send referrals, but we have a system where we can directly message those referrals. So if Kia makes a referral and she sends one to, let's say Monarch is one of the providers, she literally can then have a conversation using the technology. So as the agencies were accepting the referral on the other end, they can ask questions and they can go back and forth and qualify what they need to do there. We will create a metric dashboard that we will all agree to as to what some of those KPIs that we want to kind of manage and look at and follow up on. And then always ongoing technical support to make sure everything stays static and is really working well.
So can I just say, as opposed to what I just described to you about how the manual calling, this would be Kia with an iPad at the location, going through the questionnaire with the individual or the family and hitting a button and hopefully making an appointment for them right then, or if that's not available, getting a response within the next couple of hours and following through. And the back-end ability to make sure they went to the appointment, they didn't have transportation challenges, they showed up, they got their medications, whatever they needed to have done, follow up with that individual and make sure that we can continue to support them.
So as part of that, we will also provide management services. So my service, along with Dee and a couple of other of our colleagues, will continue to watch referrals and make sure that our network is responding, to make sure that you're receiving the services that we have promised. And so we have a quality program that we would institute within our network members specific for this program. And then we would oversee that and manage that on a daily, weekly basis, along with, we will do bi-weekly calls with stakeholders. And then we can develop the cadence from there. But usually bi-weekly when we first start, for at least the first 3 to 4 months. And then we can look at it from the standpoint. And as we go along, as I said before, we do have a really robust network and services, as you saw. But if we identify there are some other needs that we're identifying here in Apex that are specific to the population here that we're not meeting, I can always grow the network and bring those resources in. So it's just not a one size fits all. It really is developing what we can identify as the needs for the community. And then finally, just kind of this basic fee structure that we have for referrals and allows us to continue to manage through. The management component is a portion of it. There are other aspects of it that we will have to grow as we grow with the program. And so this kind of gives us a buffer to be able to do that.
I take it back to 2 slides ago, the case management services. So how big is your case management staff? Because this is not dedicated to Apex, this will be like with just one partner in the mix that will send referrals, right? And so there's a case management organization or group of people. Like how large is that team today? Like how much capacity do they have? What kind of, at what point do they start topping out and get, is new capacity added to that case?
Are you talking about the actual agencies receiving referrals?
So the case management, right? So like who's actually doing the case management? Because right now, and the reason I'm asking is right now he has one, right?
And she would continue to do that.
And so I'm full for. I think it's very innovative. I love the idea, right? I'm uncomfortable with just having one resource on our staff to do case management work, right? So I think we're going to need this, right? And so just wanted to kind of get a sense of how big is this the back office that you work with, to do this case management type of work, and will it help relieve some of Kia's responsibilities so that if she can be more into the community, less in the office, poking her right back.
So we have our staff behind it, plus I have some WakeMed resources for our behavioral health team. So we will not be doing the case management. It actually will, the onus falls on our network members. Once they get the referral, it is their job to reach out to the patients and to the families. It's their job to communicate. But what we do is we provide the oversight to make sure all of that is occurring. And it's occurring in the timely manner in which we expect it to have happen. But from a WakeMed's perspective, we will not get involved in the care, but we will be part of how we manage, how that care is managed. And we will oversee it and manage it from that perspective. So we'll be communicating with Kia to make sure she's getting everything she needs on a bi-weekly basis. And if she has any issues, she will literally have a 24/7 contact to say, I'm not getting a response, I'm not getting my needs met. What can I do? We'll take care of it.
I think to some of what you're asking is, one being just Kia, agree on the front end, we don't want to have one person within the police department who is responsible for all of this. Part of that is we're navigating into some territory that's never been done before, like Megan was saying earlier, and there's a bit of a HIPAA component to it. So we have to be conscientious about who we offer access within the police department, whom we offer access to actually be in the system. So we're starting with one as just stepping into this as a new innovative approach is first. The second piece is that from a social management, from the social network piece, Kia is going to continue to have that as somewhat of a primary responsibility, but that creates two things for us. One, WakeMed kind of provides a bit of that support system. So they're not going to do it on our behalf, but if she runs into trouble or difficulty or has problems navigating something, she has resources or support through WakeMed to help her facilitate that. The third component is that it's dramatically reducing the amount of time that she's in the social worker role managing cases, and really it translates her into being a liaison, because through the system she is able to partner the person, the individual, the family in crisis with the proper expertise and resource that's needed. So then she steps out of more of the social work capacity into the liaison. She then is able to monitor the system to see that the individual had the appointment, their transportation needs were done, but she can help connect people outside. So she's more liaisoning at that point than actually being the social manager, which is very time consuming.
So and I want to challenge you on that a little bit because, we have one licensed clinician on staff, right?
Mm-hmm.
And so I want her to be doing the social work because that's what we hired her for, right? What I don't want her to be doing is the case management pieces that is basically the administrative follow through, which prevents her from servicing the community, right? Because now she's back in the office, opening at her computer, right? And that's where I'm asking some of the questions, like, where is that responsibility going to lie? Because I want to maximize her social work time because, that's a very precious skill.
Absolutely.
Of which we have only one. Right. And so that's kind of where I'm trying to kind of figure out where the division lies. And again, like I'm fully supportive. I'm just trying to kind of understand the mechanics.
Those are great questions.
Yeah, and for that point is we are certainly, the police department is rebalancing CART. So Kia was brought in as a clinician that is still in school logging hours for certain certifications that she needs, and was really predominantly working in the social work after the fact. And we as a police department recognized we're doing our community a disservice if we essentially say we don't have the proper resource to send at the moment that crisis is occurring. So we can send, and that's what we historically were doing. We were sending a police officer. That's not their expertise. Kia much more has that expertise to respond to the person in crisis. So she's actually going into the community now in that rebalancing that we're doing. She's now going out into the community with the person in their moment of crisis. When say suicide is an example, she is the best person we have to help them in that immediate moment. Then slide across the scale to what we had more focused prior, which was the social work piece. And that's starting to where this partnership kind of balances that scale for us to then review and assess, are we meeting the needs immediate? And are we fulfilling the needs long-term? Because
And sorry, I don't want to cut you off. I don't want to dominate the whole conversation. I would love to have an opportunity to continue the kind of the exploration, right? Because I see other opportunities here, right? Because again, like that, being out in the community, dealing with a person in distress is where I see Kia's value being, right? But Kia doesn't scale by herself, right? And so, is there an opportunity for volunteer labor with other licensed clinicians? Should we be looking for somebody who is fully licensed and can operate independently, or even a supervisory license who can provide the oversight directly to Kia or whoever on staff? Is there a role for the Red Cross here, because they have a crisis response team that we could potentially, partner up with? Again, like that's more being out in the community.
Yeah.
Not so much the back office that we're talking about here. Like, again, I love the idea, but I see some other things that, if we really want to be truly innovative and then go all in, right, then I think there's additional opportunity here for us to explore.
And I will say, we do have an additional partnership with Advanced Health. They have a behavioral health office here. They have instituted a mirroring position to kids at their own expense, a case manager that she's able to also utilize through. So we're not just looking at WakeMed as the singular response or singular partnership. We have that partnership in place right now, and they've just hired that person. So we're working through what that looks like. But that's really a conversation between them and Kia in a case management standpoint. So there is another accountability piece, so we make sure people don't continue to return, that we're able to manage that better. So this isn't I'll bring you 12 other proposals. Like, we got a lot of other things on the out there, but this is one of them. And that piece, the Advanced Health piece, is already in motion and continuing right now, and building that out. So, but it is a program that requires administration, it requires community engagement, and then it requires the actual job. So we do need to we're looking at a way we can at least allocate the resources we have currently as efficiently as possible, and then build on those to build out a larger program.
Okay.
Any other?
Can I ask for a follow-up conversation to further?
Sounds good.
I just wrote that down for Randy.
I just want to say, Tom, thank you for the presentation. Megan, appreciate the presentation as well. I love the long-lasting relationship that we have with WakeMed, and I appreciate you serving on the Mayor's Misuse Task Force. So you've been a great help there. One of the things I've talked about before is expanding the CART program. I think we didn't hear the numbers today. I think that's forthcoming, but we understand there are many crises happening in our community. So this right here will greatly help manage this in a different way, innovative way. So my question is, what is the next step? Do we need to write a check, or what are you waiting for?
Sure. Take checks at any time. It sounds like there's some follow-up conversation that, the councilman here is asking for, and I'm sure there are other people might have questions, but yeah, I think the next step is finalizing the proposal and bringing it forward.
And if there's agreement to it, then we'll put a formal proposal on the table. So part was to really bring this to the table and let folks take a look at it and ask questions. And then if we agree upon concepts, and we'll put a formal proposal.
This is basically, listen to the conversation. This is what you're selling is basically a platform for case management for mental health professionals for case management stuff, right?
Yes, but it's more than that. Because if I have a case manager and I send information out, somebody responds, great. If they don't, it's no big deal. Whereas this, number one, you have to respond. You're going to be on my platform. Number two, you've got to make sure you give appointments. Number three, we're going to track that. And number four, we're going to know what the outcome of that referral is at the end of the day. And what happened to the patient at the end of the day.
How new is it? What's the history here of this platform?
We've been used, WakeMed has developed this platform over the last 6 years. So like I said, the data that I showed you earlier from the hospital's perspective has been immensely effective. So for example, I'll give you one more data point. Avoidable bed day is a definition that we give when an individual patient who comes to the hospital may have a medical issue as well as a behavioral issue. And so obviously we have to clear the medical condition before you can dispo the disposition for a behavioral health issue. So when a patient is medically cleared, the clock starts on then the mental health disposition of that individual. So for every hour that that patient is sitting in that bed, it's an acute care bed. It's not a mental health bed. So number one, they're not receiving the quality care that they need now for that condition. Number two, there's no reimbursement mechanism for it. And so it's kind of the lost day, lost hours, lost bed. So before the network was developed, we were averaging over 1,900 hours a month. We are now down to 250 hours. Our length of stay used to be 6.5 days for individuals that need a behavioral health disposition. It is now under 1.5. Why? Because we have now the ability to get access to services that leverages, yes, a platform, but more importantly, the collaborative relationships that we have with our partners. And so that combination of two is what makes it work.
So is this the same platform that like MedER down here or others?
Exactly the same one.
What they would use if they were?
Yep, exactly the same one. We'll just adapt the needs of what Kia and the team will need and what you all will need to make sure it matches. And again, it could mean different providers. So for example, I'm talking to Avance right now as a potential provider. So I did not know there was a relationship already there. So that may be one where we want to partner with them pretty quickly so they could be as part of the platform as well.
I would say, you're almost at 4.
I'm sorry.
Well, now you good? Wrap it up. Get this everything.
To expand on the next steps, it sounds like we have some potentially individual dialogue, not necessarily another work session, but having some of those individual dialogues. I'm assuming at this point that if we can get to a good proposal, that council would like to proceed sooner rather than later. It's obviously not something we budgeted for this year. So if it's something that we were to enact before the budget, we have a budget limit, figure that out. So we'll kind of work through the dialogue, get a proposal, and then depending on time, you come back to council.
But you're, just for the same time, you're scheduled follow-up conversation with council members.
Yes.
Very good. Thank you all so much.
Thank you, appreciate it.
All right, keep things rolling here, Mayor. You ready? We'll go into our fire department update. We've got Keith Herman here. PowerPoint presentation you all have in front of you.
Right, Mr. Mayor, Council, it's an honor. Thank you for this opportunity to be back before you. February of 2024, I stood here and we made a lot of headway on a vision. And I'm here to give updates for that headway, but we're also at a point that we need some additional input. We need some additional guidance from you. So I'm very excited to provide this update. I've got some help from economic development that's going to speak, and some help from Daniel Edwards, who's going to speak, talking about a space needs study town-wide. So let me walk you through it. I want to start off with a real quick recap of that work session that we had back in February. So the first thing I proposed that we moved on was to remodel Fire Station 3 to accommodate the crew and the equipment from Station 1, combining the two. I've got a slide in a moment on that, but this is underway. We've already hired a designer who we're working with, and this is in the works, and we're very excited about that. The second huge vision that was proposed and we are super excited about was fire administration with an educational space downtown to maintain that fire department presence. And we had lots of great conversation about this. And the vision of this is not just a museum. This is a space where there's programs, there's interactive stuff. Think of a Marbles Museum type space where kids of all ages can run around and do things and get educated at the same time. So this maintained that space down there, and it was the focus of a public-private partnership, and we'll speak to that in just a moment. But at the same work session, if you remember, that land behind 3 was very popular and everybody wanted a piece of that. So at the same work session, we had a presentation about affordable housing. At that same work session, we had a presentation about a work tower. But fast forward 9 months, what has happened? We've been very busy behind the scenes. A lot's changed. This town changes fast and we got to keep up with it. But number one, affordable housing was not recommended to go back there. Okay, so there's other plans in the works for that. Number two, the water tower is not currently slated to go back there. The town hired a firm, Creech and Associates. They came in and did a town-wide space needs study, outlining space needs not only for the fire department, but the entire town. So this giving us some information, and Daniel's gonna speak to that in just a moment. And then the last bullet I want to point out is at that same work session, you guys made a comment that anytime we're doing a project, let's make sure we're building it for tomorrow, the future, and other departments, not focused on just that one department. Who else needs space? So we take all this information and we're gonna suggest a little bit of a pivot right here. So does it change the vision? I would like to say it enhances the vision, okay? We now have an open canvas again. All right, so the things that we wanted to look at now was addressing the space needs for multiple departments, not just fire. It came to my attention, do we want to look at increasing the marketability of that downtown building, the public-private partnership? But please keep in mind that last bullet is the most important, that we want to keep that presence down there. So what does this look like? How does this make this vision pivot a little bit? So right here, Creech and Associates provided us this visual, okay? This is not an improved final product, but this is the space needs study, and Daniel's fixing to speak to this and the next slide. So this is already underway. This is in the works. We awarded the contract, I guess would be the Davis King, would be appropriate to say at this point, as an architect. So we are beginning that right now, and I've got a timeline and the slide coming up to show you where we're at. So this is phase one, but now remember, we've got this blank canvas. Should we change things up a little bit? How can we provide space to the rest of the town? How can we better utilize this space? So then,
So George, all of you probably know that we started a facilities master plan about a year ago, last fall. And we've been slowly making our way through that. We've made a lot of progress over the last year. Some of those things we looked at was the facilities condition assessment of 21 town facilities. During that time, we looked to see what the condition of the buildings were, what the square footage is that we have with the town now, and if there's any major replacements or things like that coming in the future, and what those budgets might look like. Those reports have been shared with our facilities department to help them with their CIP budgets going forward. We also did a space needs analysis where we met with each town department and other user groups to find out what their current need is as far as space and their staff to sign on the org chart, and also what it would look like over the next 20 years going forward, you know, as they grow and the town grows. And as part of that, we did what we call the facility master planning. And we master planned the departments and saw the space they needed, that currently what they're going to need and what we have. And we see that we're in a real shortfall. One of the master planning options we looked at was, of course, fire, of course. And that's what we're looking at here with Station 3 combined with Station 1 company. And this is the master plan that was developed for that site. That could be what we call the public safety site. But is for now, it's the Fire Station 3 combination and innovation. Slide keep this pulled up is what we look at as a potential for the overall site, and it does include the Fire Station 3 renovation and the warehouse storage building out back as part of phase one, like Chief mentioned. But it also shows an option for an administration building to help with some of the short sides that we have with square footage within the town. And so what could go in that building, and we got some options of fire administration, some police department maybe, and even here in town hall, there's some shortages on some of the space that the departments need. So those are just some of the options to consider for an administration building and this site.
all right, so at this point, I think you're starting to see that little bit of a pivot. And as Joanna walks up, I want to talk about this slide for a moment. Please don't make fun of my cropping and outlining that I put together here, but I wanted to share this visual that that presence of the fire station look that I painted, that picture is still there. That 4,000 square foot space that we're calling educational / museum is still there. The pivot is, do we want, having conversations with administration, with economic development, we're looking at a developer to come in and just look enticing to them to develop it for us. Do we want to provide more square footage for that possibility? Or we're taking up 7,000 to 8,000 square feet for my office space, the administration office space. Now, we do realize by removing the offices, we don't want just this building to sit there. Some offices need to stay. The risk reduction division, our community risk reduction staff who are out in the public. I've even added one to my 4-year staffing plan for when this opens up to have another person down here. So we are very intentional about that and what this space looks like. So this is just an idea to increase that marketability. Joanna, I'd like for you, we got a couple of slides. I was with this one. Can you go back up, Joanna?
This is good. So, just as a reminder, a quick reminder, the approved Apex Downtown Master Plan and Parking Study. There was 2 areas that referenced the fire station. So, they listed top 10 projects, I think, Shannon. And project number 6, I don't think there's any particular order, but was to re-envision the fire station as a civic and mixed-use development. So that was one mentioned in that master plan. And then there were some key goals also listed, and key goal 8 was to honor the history of downtown and have a reimagined fire station on Salem Street. So this is 2 references in the approved plan that you all approved. And so we just want to make sure that we're always remembering things that we have approved in the past. And I know things can change, but that was what was discussed and agreed upon previously. This is where we start to talk about public-private partnership, PPP. So what could or should go in that space? There's been a lot of interest and suggestions. I know you guys get bombarded all the time with that stuff, but we hear it too. We hear it from businesses. We hear it from developers. We hear it from citizens about ideas for that space, that building, if it were to be, torn down and rebuilt, what should go there. We've heard everything from, rooftop restaurant and bar to an art gallery, active artisan space, co-working space, all kinds of things. So, but again, I think the key here is what is the highest and best use? Because you guys know that is really valuable property in a lot of ways. And it's also very sentimental property. So based upon our knowledge, professional experience, and the knowledge of the market that we have right now, here are just a few potential uses for the space that we came up with. Of course, Chief already mentioned having have a fire presence there. But again, retail and restaurants, and open concept space for community events. Think the Rotary Pancake Breakfast, professional offices, maker space or incubator space. That might be something that can have a real great potential there. And then some type of, again, rooftop gathering space. So Chief's going to talk in a minute about next steps. But again, we think that going the route of having a market analysis feasibility study will really help us identify what those highest and best uses could be, and will really help us shape our game plan for going forward.
And yet, to show you where we're at and where we think we want to go, this is an aggressive timeline, and they work together. So we're not sitting with the building unused downtown once those firefighters move from station 1 to 3. So station 3, Q4, what we're in right now, again, we've selected Davis Gain, and that process has started. Q3, the beginning of next fiscal year, we'll start construction monies in that CIP to start that project. They're telling us 12 to 14 months. So if everything's on time, station 3 should be completed Q4 26, possibly into early 27. If you look here, that would be when they move out. So Q1 of 2025, she mentioned the feasibility studies, then the request for proposals, and start design, planning, permits, and that construction to start at the same time the crew leaves station 1. Again, we don't want this facility, it's already in poor shape as it sits today as we use it. We don't want it to sit there unused and just be an eyesore. So it's time for this to start just like that. So, 2 big things here that we need to discuss. Number 1, the move of the administration office to Hunter Street. Open that up for discussion, and then also the ideas of the PPP. If all that goes as planned, fire administration building here is a timeline to start design, construction, and open that facility. Again, that would be a facility, not just fire. As Daniel mentioned, possible other departments townwide while we're doing that project. We're looking townwide, and we're looking at that space needs stuff. So that concludes the presentation. Had lots of discussion with administration, just speaking with Randy. We're moving. I hope you see that. We want to continue moving this project. It is very exciting for the life of not only the town, but for the fire department. And I believe with all my heart that this will become the cornerstone of our downtown, not just because fire's in it, but this whole project. But I think we're, I've speaking to my staff last week, because I like to make them aware of what's getting ready to happen. I don't want them to find out through that camera over there. So I give them a heads up of what we're talking about. And I said something, I said, Apex is changing, the downtown is changing, let's change with it. And that's currently not, we've already approved that we're moving that response operation model to Hunter Street. This space that we're proposing is changing with it. I think we have a lot to offer the town in the downtown landscape. So again, the two things on the table to make you aware of and get your input. The move of our office is only not that downtown public presence piece, but then also Joanna is ready to hit the ground running on this proposal, looking for developers. What does that guidance look like to help her write that RFQ, RFP? Or something. So at this point, I feel like I know time was of the essence. I didn't have any questions. I wanted to fly through it, but not fly through it, but get enough time where I know at 5 o'clock some hard cut off.
Yeah, I do have a couple of questions for you. So in our vision of Fire Station 3, again, kind of in the spirit of building for the future, I only see 4 apparatus bays. Is that going to be sufficient for the combined Station 1,
Yep.
Station 3, plus whatever?
So yeah,
might
great
be
question.
needed
Great
10
question.
years from now?
So part of the space needs study gave us a roadmap for not only our administration needs, but our fire station needs. So they're recommending that we build an 18,000 square foot fire station, which is 3 bays, appropriate living quarters and support quarters. And that falls into that square footage of a 2-company battalion chief fire station.
That's good. And then as far as the, if we're looking at the campus more as a town campus, right? That's phase 3 administration building, 3 stories. Do we have a rough idea of the square footage of that building as, penciled in here versus what the study calls for in terms of the total administrative space needed?
So I can speak to the space. The study came back that we currently need 7,800 square feet. In the next 20 years, that would be 10,000 just for fire administration. Right, Daniel, if you want to speak to anyone else. So there was thought of making this 3-story.
Yeah, so I'm thinking, what about the PD? What about, Parks and Rec, because they're looking for space,
Yeah,
right?
right,
And
right.
so, like, if this is a campus that we can develop, like, in the grand scheme of things, it seems like a small building that we're putting there,
Yeah,
right?
yeah.
So,
Daniel, did you have any?
Yeah, so we looked at overall site and we got some constraints on where we can park it and so forth. The max we can build that building right now is 14,000 square feet, which is roughly the size of the Mason Street building cost. Around 2 stories, 7,000 square feet.
right.
And that's all based off the site, the parking, the stormwater, things like.
That's not, it will address your needs, but it doesn't address a whole lot.
There's some innovative things that we can look at on the Michael preset. That this is all preliminary at first look. But so if we do some different type of stormwater under the parking lot and that sort of stuff in the final design, then we may be able to get another story at 3-story.
And previous time that we spoke, we also talked about potentially going vertical on the existing building that's there. So to actually create administrative offices as a second floor on the fire station. Is that still an option, right? And then will that give us a little bit more play to create additional square footage for administrative functions?
The designer will be looking at all of that in detail as they move forward in the programming stage. So we're just getting the contract put together now. So they'll look at that in programming. They've got the master plan that we've got. They've got a previous study that was done back a few years ago on the same station. And they'll take all that data and input from what our needs are now, and they'll evaluate the best way, the most efficient way to expand that footprint. Because we, in the master planning stage, we're looking at going up, going out at the existing facility. So we're looking at different pieces on that as well.
So yes, it's all on the table.
Okay. Because just as a layman observing the picture here, like this looks a little tight compared to what I think I know about what our space needs are, because every department seems to be looking for space. Fire needs it, police seems to be looking, Parks and Rec is looking as well, right? And so, great, yeah, I like the idea, right, but, it feels a little tight for what I think our future needs to be. Like, so if we're developing for the future, I want to make sure that, we're looking 10, 15 years out and not just what our current needs are.
In the discussions we've had, I don't think this was gonna solve all the space needs, and I haven't seen everybody's, but certainly help. Yes, this wasn't the site to solve everyone's.
No, but it's a good, it's a relatively large piece of property that we already own, right? And so it's kind of an opportune place to start solving some of these needs and do it, at scale instead of, doing the minimum viable, right?
So in this initial phase, one of the things we'll be looking at, like we're looking at the stormwater, we're going to maximize that site. We're not necessarily building everything on that site. We're maximizing like the infrastructure, where the infrastructure go, where the parking go. And we're, all that's kind of in that programming piece that will be up front. Make sure we have that locked down and understand what we do. And then it will be, we don't know the size of the building, but we'll know the footprint because we can go up with it, right? We're going to maximize the impervious on that site from the standpoint of how we treat the stormwater. We'll do that in the first phase so that we don't cut ourselves short.
And we're also, you're right, when there's other departments that have space needs, we're also doing master planning and area road, so see what could potentially be done over there to having more resources potentially for the departments there. So we're looking into that too. And I don't know if it's clear enough, but part of that, what's proposed there is an existing building. What's you see on the south, plan south, is an existing building, which is renovating to store in the space like this.
To add to that real quick, we even looked at current PD and potential expansion there. Okay. And some options. So we're looking at all this simultaneously, even the environmental education center, how we build that and maybe a second story that could help us with some of our first base. So we're looking at all the options kind of simultaneously, but there's a lot of moving parts. The big picture for us is if there's endorsement from the council to go with this as more of a campus concept, then we can start to plan that way and see how we can maximize this site and see how much of our needs we can meet here versus looking at those other options.
Question real quick about, so if stormwater is an issue here, right? We're able to treat stormwater, be aware of it. We're looking for permeable pavers and things like that for our parking areas in some of these areas so that it can address some of our stormwater needs.
Yeah, we're going to look, again, we're in the preliminary stages. We're going to look to maximize that site, keeping stormwater in mind up front. I mean, it's kind of like what we've done here at this campus where we've been able to, we had to add some underground to be able to do senior center, but same type thing. We were able to do community center in this building with just the pond itself. When we added the senior center, well, okay, that pushed us over more than what we could do with that pond, so we had to go some underground. So there's some things to maneuver that we can look at there. So it's obviously everything that we can do that's like in the natural grade, like not proprietary, not underground, is cheaper. So we'll try that route. But ultimately, we want to maximize the space because land is quite expensive, right? So we want to maximize that, and it's a great location. And, right now, we looked at this on a flat plane. We said, okay, this is parking. You could do a small deck or something there. You can address parking in different ways as well. So because once that footprint of impervious is considered on the ground, it doesn't matter how far up you take it.
So let's say impermeable pavers, something like that, that may be addressing that same issue.
Yep.
So,
There's, and I've seen this overseas, not here yet, where there's actually parking lots that are not impervious surface. They're basically grass, and it gets structural supports like that that's placed in the ground, but it's still,
We're going to be doing one of those at Pleasant Park.
Okay, well, I'd love to see it. Great idea.
I just got it. You just.
And we're still, we still have the old admin building that you guys come at. That's still our property. So I know that gives us some development space there. I like the concept.
That's.
It's going away. It's going
Gonna get faced over, right?
Yeah, it's going away, but that's, trade. I like the idea of the concept of the campus. I do endorse that. I do have a question with regard to the Station 1 though. And I like the idea of public-private partnership, I think that there is some value of being able to figure out what's the maximum best use for that property. I do think we've got to ask ourselves the question of if we currently have a fire station there, and there's a big public sentiment about having fire station there, regardless of the fact of whether or not it's critical for you guys, or there's a public sentiment behind it. Are we creating a sense of trail if we put a business there and people start to see something that's a business they're operating? I'm not saying that that is a sense of a trail, but I think that's something we just need to account for when we're looking at the issue. I mean, I find myself supporting this thing, but I think that's something we got to think.
The answer is going to be yes to that question, right? To some degree, that's the con, right? We know the con is going to be somewhat fierce, right?
So from the February work session, that decision was made. That's why we're doing the campus, but this is a meet in the middle. And quite honestly, the conversations with the folks that's been around the longest, is some of the volunteers are excited about this. I'd be lying if I said some of my staff wasn't excited about it. There's an uncertainty. They enjoy having a fire station down there, but they also understand the operational and the financial impact of maintaining those two stations 0.7 miles apart. We treat them like one station under two roofs. So that train, if you would, left the building. But this, if it turns out as visioned, is going to be second to none. That I've heard a lot of folks say they would be very proud to bring family, friends to see this. And I think if done right, folks from all over the county and beyond will come visit, experience, shop, and eat while they're down there. Again, that's going to be a very innovative Marbles Museum. I throw that out, Disney Field type experience. It can't be the boring museum. It's got to be stuff that moves and makes noise, and I can play with it. Can't tear it up, run around, let them do it.
I love the ideas.
So do I.
I like it too. In terms of the architecture, kind of keeping the kind of 7-bay look that we have right now, because, we know we cannot save the existing structure and redevelop it, but kind of maintaining the look, having that border, I like it a lot. Best use, I'd like to get a little bit more input from economic development as to what that could look like, right? So like what we would propose there. Because I do think that we do need to reserve some space for community events, in addition to the museum piece, right? Like have some public use of that space.
I think that's going to happen next door too, because we're also talking about, renovating the depot area, which is going to be a lot of public space there. So, I mean, this whole area is eventually going to be changed and different and used in better ways. And I think this is, this is a great way to show how to do that.
I just want to say thank you so much for weighing in on the volunteers. I want to make sure that's cool. The way I understand it, there's still going to be presence from the community risk reduction staff. They can still pass out the fire hats to kids and things like that, right? So
we want to be very intentional of certain hours it's open. It's not open every day, all day, but also we want to schedule programs for all of it. So again, we want to offer, whether it's CPR classes, first aid classes, CERT classes, and then of course the younger kids coming by to, because what's envisioned to happen inside of that is going to be some fun stuff, whether it's going in mock theater looking rooms, kitchens, bedrooms, what to do, what not to do. There's gonna, I hope, to be a real fire truck, not the antique truck, but also a real fire truck in there that's on display that they can climb. Some of that is in some neighboring communities as well that we've been looking at. So
there's certain like, why don't you want the corner office downtown on Single Street? Looking over all the
I'm okay with that too.
But this move of administration from downtown to Station 3, is there some operational efficiency there that's driving that? Like, what is the underlying purpose that do you think that's the right thing to do here versus trying to take this space here?
So the initial vision of our office being here was because it was the available space at the time. I would love to have my office, if I'm being quite honest, down here. I think that's really cool. But also when challenged by my bosses to say, look at it from a different lens, I have to be honest, at first I was like, I'm being honest, I'm like, no, we've already agreed, on, but honestly, trying to be the team player with economic development, with the other needs of other departments, this is the better move, right? So we would need 20 parking spots, and we can make it work, and I'm willing to try, but, that's a challenge as well. I got back from lunch today, and Engine 35 is in the parking lot at admin, getting some materials. See you in April, getting a uniform piece. So where's the spot? We can make it happen, but so that logistical day-to-day operations, and I asked my staff, executive staff today, hey, downtown or over there, what makes the most sense? And they all think this is cool. But at the end of the day, operationally, the campus idea next to that warehouse, because that's going to be full of all our logistical supplies, uniforms, station supplies, janitorial supplies. So Chief Maynard's group of support services is in and out of that. April and her staff with the van in and out of that. So that's a challenge here. So I don't disagree with you, but I do think we need somebody here. What does that look like? We need to identify that and coordinate. Who is our outreach community risk reduction coordinator would be here, along with another one that, again, that's in the staffing plan, and possibly somebody from fire marshal's office.
Are we planning to retain the fire hydrant that's going to let the old mission? That's very good.
So it sounds like we're good to go.
Joanna, do you need any information?
That's what I was gonna ask too.
Sorry.
You feel good with where we
I
are?
guess parameters of duty.
Yeah, I just think we need to, keep our minds open to what the feasibility study and market analysis. Because I know, like I said, we all have some great ideas. There's a lot of sentimental ideas, but I think we need to also let the market dictate some of our decision making.
The number of stories also is a question, right? Because we had a vote, you voted no, I think, to raise the limit from 2 to 3. And this is talking about 4 here. So it required another fight about that. So
From February, we were at 3, and I think you actually brought up the third being offset, like shown here. Depending on developers coming in to do this and looking to make money on part of this, do they need more square footage? So it can go to 4 per town ordinance. But I know that's a big question.
is that right? I don't think that doesn't sound right to me.
I think it can, but I think that's where, they're gonna have to make their business model work. And if they can make it work at 2, great, but it's probably gonna be 3.
And at this point, we would encourage you to be open. You can always say no, but we would encourage you to be open to concepts that come forward that would allow for potentially, of course.
And can we check what town ordinance currently allows?
I believe it's 3. I'm pretty sure it's 3.
And the Highline building is 3.
And we changed it, I think, before that came in, but there was a vote.
The biggest thing that I'm looking for in this is, I'm great with private business coming in, but I don't want to see this all go to office that's so restricted that the public can't get to it. Because that upper piece, I just perceive people, hanging out if they're having a cup of coffee, having a glass of wine, looking over downtown. That's the ultimate vision that I foresee knowing this. Like with the Highline building, yes, there are balconies, but they're restricted so that people can't walk up there and look over downtown. That's just.
I think we all expect, well, I do at least, the second floor is the office one. The first and third are for the public
Yes, that's.
use. That's what I would have thought. And I kind of wish the Highline was like that, but now we have control of this one because we own the land
That's.
and can say what we want,
Yeah.
right?
Definitely open, for sure,
And
but.
we want to get that kind of input to whoever's doing that now. We want to get them like, we'll go back with the plan as well. Some concepts.
Do you anticipate that the way it would work is we've got an RFP with a sketch like this, and then someone on a proposal where we would give them the land and they would build us a fire museum or something like that? And they would provide some public space
Right?
and then use the rest of the space for their own needs?
That's one concept. There's a couple different ways to price it.
Yeah, it's so valuable. It probably would be about a break even, I would think. I hope.
Yeah, or, perpetual lease of the space, right? Like, they not only build it out for us, but, we could basically get, no rent, like whatever, right? I don't know, we can figure that out. Let's see what it comes back to.
like, I mean, like it's the backlash and the public interest. They don't want us, they don't want to see the use to be a significant public. Thanks for these to be what that looks like for the long term, but what now until we get close, I guess. But I think it needs to be something extraordinary, right? Like, I think we just fill it with like more shops. It's just kind of a continuation, which is good, but it's just kind of more of the same. Might look unfairly on that, but it's something innovative and new. But also I'm thinking you have to balance with it being active. Like we could put a makerspace in there, but that's only used a couple hours a week. It's empty the rest of the time. That's not great.
And their business model will not support a space like this. Like, I would love to see a makerspace in the town, and then, I'd like to tinker, but I don't think that this building is the best use for it.
And when you say business, it could even be businesses that are like interactive businesses. So it could be businesses that you come in and do like think like wine and design or something like that. So it would still be like not a business where it's an office business, but a business that brings people in. That's an interactive thing. So the kids can go downstairs in the fire museum, the mom and dad can go upstairs and do wine and design or whatever. So coffee and play.
Firehouse stuff.
Yeah.
Yeah.
They're gonna want to come, right?
That's
I'm not sure we're gonna want them, but yeah.
all right. You got everything. Fantastic. Thank you, Chief. Appreciate you.
All right, so that concludes the official fire portion. And the next thing we have is we have one of our candidates will be coming in around 5, so we do have an opportunity for a small break.
Okay.
If our candidate does come in early, we may be able to start.
Okay, that sounds good. Okay, all right, to the recess, 4:55.
It's